You may hear a lot of horror stories about how the epidural is going to affect that baby right after birth. Today, I'm going to tell you what the actual studies show, what I've seen in my 20 years in labor and delivery, and how you can make the best choice for you and baby for your pain management during labor. And while I hear all these lactation consultants telling me all these things online, I have actually seen thousands of moms get an epidural, and then I've helped them latch their baby on right after they've had the baby when the epidural is closest to the baby. So I really understand the differences, what I see in patients, and then I've also read all of the studies. So when they say that they're an expert on this, let's take that with a grain of salt, shall we? And yes, I did just have an IBCLC who works outside of the hospital telling me she's seen this so many times. So I said, have you read the studies? And she was kind of like, why do I need to? I've seen it so much, but there you go.
Announcement. The pregnancy nurse is a nurse, but not your nurse. This is informational, not medical advice. Thank you.
Now, before we jump into this, I want us to realize that babies who mom gets an epidural versus babies whose mom didn't get an epidural come from very different camps, right? A lot of times the babies who the mom gets the epidural, their labor is longer. They've been induced. There's a lot more complications for them. They might have high-risk things like high blood pressure or preeclampsia. So those babies may just inherently be very different than the babies whose moms did not get an epidural. Now, the first one that everyone loves to talk about is fentanyl. Now, most places in the United States, the epidural is concocted by the hospital. It is a standard thing. And most places they get fentanyl and then something that numbs something, usually like a bupivacaine. That's sort of like lidocaine, like if you get your teeth fixed or if you have stitches, that is what they give that for, but usually it's a combination of those two things. Now, that doesn't mean that you couldn't have something different, but usually it is standard in the hospital, meaning most people get some fentanyl with the epidural. Now, as a caveat, there are people who get fentanyl just straight up in their IV as an IV pain medication as well. So I've seen patients of babies who got fentanyl during labor and people who've gotten fentanyl through the epidural. And I honestly don't see a whole lot of difference in this, but we're going to dive into the studies. The first thing is all of the studies show that it really just mostly doesn't affect them. There really isn't a difference in breastfeeding rates or success between babies who had some fentanyl with the epidural versus babies who didn't. Now, I haven't read studies about babies who got fentanyl as IV pain medication. If you're interested in a post on that where I can look through the studies on that, tell me down in the comments so I know that there's interest. First off, it's important to really know that fentanyl in your IV is going directly into your bloodstream versus fentanyl in the epidural is actually going in the epidural space. It is not going into your bloodstream. So if we were to check to see if you'd taken fentanyl, it is a very small amount that ends up getting absorbed into the bloodstream. I know I hear people all the time saying, oh, I got fentanyl with my epidural. I was so tired. But the reality is you're mostly tired because your body is finally able to relax and you're able to get some rest after being in so much pain. It's not so much from the medications that we're giving you. Now, of the studies, the ones that showed that there were a difference, it did show that when something like that happened, it meant that they had higher fentanyl percentages in the medication that they were giving you, or you were on that medication for an extended period of time. So those also mean that those babies had a much longer labor. So again, very different to compare those babies who had a long epidural versus somebody who had a natural birth and was only in labor for a few hours. Birth is very trying on the baby. It's squeezing on them. They don't get as much blood flow when the uterus contracts. Now, babies are made to compensate for that, but you do that for a long period of time and baby gets really tired out, as you can imagine. But what you can do is just get the amount of epidural medication that you need. I actually have a whole video on here about customizing your epidural. We set everyone at a standard rate in the hospital, but you can make it go up if you're not getting the relief that you need. Of course, make sure that your epidural is working. I have a whole video on what to do if your epidural is not working. I'll link that one down below as well. But you can also decrease it. If you're just like a lump on a log and you can't move at all, ask them to decrease the epidural. You don't need that much medication, obviously. It's always a balance of making sure that you're able to move and getting the pain relief that you want. So it's always a scale of these things. We can turn the epidural up and we can turn it down. And it's all based on what you need. You know what? The epidural is shrouded in far too much mystery. And I think a lot of people who are anti-epidural take advantage of that by spreading misinformation about it. I think it's really important that all patients have both medication, pain management in the hospital, and also education on natural breathing technique. You need education on both sides. The class that I recommend actually goes over both of them. I'm going to link it down below. Now, all of these studies did recommend that moms who get an epidural get increased breastfeeding support after they have their baby. And I'm here to tell you that I think every mom should get breastfeeding support after they have their baby. When you go into labor and delivery, tell them you would love a lactation consult after you have your baby. They can just click the box. Or when you go to postpartum, tell them you would love to see them. And I also recommend that everyone have a lactation appointment set up after they go home from the hospital so they can help support you then as well. I actually have an intro to breastfeeding chapter in the online prenatal class for couples. It is taught by an LIBCLC because I am not a breastfeeding expert. I've helped many moms latch on a baby, and I'm very good to know when it is not going well, but you really need an expert to help you manage things with your baby and put things on the correct course. It's taught by Katie, the breastfeeding mama. I recommend her as well. I'll put a link to the course down below and a link to Katie, the breastfeeding mama, because she can be a great support after delivery as well. She is in the Denver area, but she also does virtual consults. Now, the next way that an epidural can affect your baby is that we give you a bunch of fluids before you have your epidural. This is meant to combat your blood pressure dropping after we relax your body and take away the pain with the epidural. However, that makes you swollen. You'll notice this after you have your baby, but it can also make baby a little bit swollen as well, which can mean that they lose weight a little bit extra quickly after they are born. So we want to make sure the baby stays in a certain range of weight loss after they're born. It's totally normal for the baby to lose some weight after they are born, but if they lose too much weight, they may want to supplement with formula or see a lactation consultant. If your baby is, on the edge of that, or maybe just losing a little bit too much weight, I think it's important to mention, hey, I got extra IV fluids with my epidural. Do you think that could be the problem with a baby? Now, I'm not here to say that baby losing too much weight or rapidly losing too much weight is not an issue. It can be a really big issue. But if you're kind of on the edge of it, definitely mention that to the experts that you're talking to so that they can factor that in as baby is losing weight and what your next steps should be at that point in time. So because of all this extra fluid, you pee a lot, baby pees a lot, and they can lose a little bit of extra weight. That's what that means. When I see people talking about this online, I feel like they just want to shame people who got the epidural, or they just want to discourage people from getting the epidural. They don't want to talk about facts. They don't want to talk about reason. I think they have some ill-conceived notions about people who get the epidural, and that's not helpful for anybody. So that's just what I think about what people have come up with this. What do you guys think? Tell us in the comments. Now, what are the next steps if you've had an epidural, baby's with you? Honestly, it's all the same. As I hear people talking about this, I really just did not see a difference between babies who had an epidural and babies who did not have an epidural, or babies who moms had fentanyl earlier in labor versus babies who did not have IV fentanyl before early in labor. Those babies all, some are tired, some are not. Some latch on really well. Editor Hillary here to say that even if you don't, or especially if you don't get an epidural, sometimes those moms are so overwhelmed with stress hormones. I actually have a whole video on how stressful natural labor can be, that those babies also are sort of tired out because all of the stress hormones that have been going through mom and then eventually baby's blood system. So there's lots of things to look at in all of this, not just fentanyl's bad, baby shouldn't be getting that a lot of people seem to want to simplify it too. And I also think it's important to remember that in that golden hour, a lot of it is just having baby next to your breasts. You're not looking for baby to suck on your nipples for 30 minutes. They just won't. They're all super tired. They're all just looking for a little bit of comfort. They love hearing your heartbeat and being by you in that golden hour. And by baby being there, you are telling your breasts, baby is here. It is time to turn on the milk. So don't have huge expectations for breastfeeding right after delivery. Just know that it's a good time to cuddle and just feel the joy together because you have both done a really big thing. And the last thing I want you to do is to be shaming yourself for getting the epidural in labor. No good. Not helpful at all. So those may be some side effects of the epidural on baby, although I don't honestly think so. Personally, it did not sway my choice. I had epidurals with my babies, but I actually have a whole video on epidural benefits that I think you guys are going to want to check out. I'm going to link it up above and down below. But thank you for joining us here on The Pregnancy Nurse, where we get you prepared, not scared for your upcoming hospital birth and the epidural.